Hello, and welcome back to my place, Dr. Jackie. Thank you so much for all of you who have returned to listen to the things I have to say and those who have subscribed to my channel. I do appreciate it. As I mentioned before, we talked about DID and wanted to get a little bit into more of the history of dissociative identity disorder. As I've mentioned before, it's a controversial disorder. Even today, it still is. In getting recognized, in diagnosing, and it's still underdiagnosed and misdiagnosed. DID is usually developed in childhood. It's created because of severe abuse or trauma, physical, sexual, emotional, or spiritual, or a combination of abuses. Dissociative identity disorder is a defense mechanism when coping skills are overwhelmed by repeated crisis and trauma. DID is a person presenting with two or more internal personalities, which is where those personalities take over the body for a time. They are called alters or altered personalities. In the early 17 and 15 and 17th centuries, primarily women exhibited the symptoms of multiple personality disorder and were considered female hysteria. Unfortunately, men didn't come forth if they had the symptoms, and a lot of times they ended up in the prison system. The first medical studies in 1800s said the symptoms were also considered medical curiosities, and they were also known as but they had no education program to deal with what they had. Dissociative disorders were considered a hidden epidemic, with DID affecting 1 to 3% of the population, which doesn't seem like a whole lot unless you're looking at millions of people. Then that percentage makes a big difference. The original belief was multiple personality did not even belong in the healthcare professions in that same domain as other disorders, because it was considered untreatable. And there was doubt by professionals that it even existed, that it was real. There was too much confusion over multiple personality disorder and how it presented. In the 1920s, an article introduced the idea of dissociative mechanisms. From that article, MPD got more recognition and the possibility of it being a real disorder. In the 1980s, recognition of the symptoms of patients exhibited were later known as rare medical curiosities and classified hysterical neuroses. The stigmas around MPD created challenges in getting proper diagnosis, and patients would spend an average of 7 years before they would get correctly diagnosed, because each one of the personalities would show with different, they can have different blood pressure, they can have different, any kind of medical conditions be different from the host personality. So if someone's not knowing what's going on, they cannot correctly diagnose a person with MPD. In the 1980s and 90s, the symptoms were recognized as a psychiatric disorder. So that made it, well, okay, fine, maybe we can start treating this with something. So how did they start? They began working with patients on TV. They went on talk shows and they had the patients switch the personalities while they were on the talk shows. And many times memories came up, and it ended up being a horrific plan because patients need a safe place to learn about their memories, and in changing personalities, switching personalities, it can't be a dog and pony show. But anyway, that's what it turned out to be. And unfortunately, some of the memories that came forth destroyed families. The patients became unstable, and unfortunately, several of them committed suicide. And Patients became emotionally unstable and could not even function. Mental health professionals were criticized, and much debate about the reality of MPD began to ensue. And it became more questionable because of what the therapist had done. Clients began to recant their memories and say that didn't happen. And more skepticism and criticism arose. Malpractice suits were filed against the therapists who did this type of therapy. There was no education on how to treat MPD patients, and it became too much of a stage show, definitely not good for the patients. In 1994, the change of the name from MPD, multiple personality disorder, to DID, dissociative identity disorder, took place. And I, for my Dr. Jackie's idea, was the reason they changed that was because it was too hard for people to kind of get in their head about multiple personality disorders. And so they changed it to dissociative identity disorders and made it feel like it would be less threatening to people, I guess. I don't know. Anyway, that's just me. When I was diagnosed, I was the only MPD patient that at the time it was still MPD patient that my therapist had worked with. So it was kind of like he and I were learning together. But he did give me a lot of good help in how to work with my personalities, how to deal with the alters, how to accept them, understand them, and the process of integration had begun. The recognition of DID has come a long ways, but still today there is not enough education and there is not enough help for those who are dealing with dissociative identity disorder. From my research in doing my dissertation, the therapist said that there was not, little to none, did they get an education of dissociative identity disorder. So what they did in their therapy practice, they had to do by trial and error, or they had to do their own research to find out about dissociative identity disorder. One of the best ways one of them found was they had a group that got together and discussed how to deal with and work with patients and how to recognize and to diagnose. Because without the correct diagnosis, patients can't get the correct help that they need. My goal is to be a positive voice for dissociative identity disorder. I want people to understand that a DID patient is not a scary person, that they are a regular person like us. They just have this challenge to overcome. But I've seen in my years of therapy how people would kind of shy away from me, or they would I don't know, just look at me like I was crazy. But I felt crazy a lot of the times when I was going through my therapy. I felt like I was just out of touch with life. But in reality, I was getting in touch with my life. And it was a struggle. But you know what? I would not have undone anything that I did in those 10 years of therapy, because they all helped me to integrate to who I am today. And even if you don't have multiple personality disorders, know that each one of us have things that we were taught, that we were programmed to, how our parents parented us, and that we can reach deep inside of yourself to find out, why am I doing that same thing that I keep doing all the time and I don't want to do? What is triggering that? And sometimes it's just a belief system that you have. Maybe you don't believe that you deserve something, or you keep negating your gifts and your talents. Don't be afraid to look and find out what it is that's making you do things that you really don't want to do, because in that you will become stronger. You will become a better person. You will become the person that you desire and wish to be. And I just hope for all of you that you will understand that you are of great value, that you were created for a purpose and a real purpose, and you are special. And don't let anybody tell you differently. As you go through any of your trials and tribulations that you go through, remember you are not alone. I don't know how I would have ever gotten through all that I did if it wasn't for knowing that my Savior, Jesus Christ, was there for me and helped me and created the opportunity for me to make it through and to become the person I am today and the person I am still working on becoming. May you have great goodness in your life. Until next time, take good care